Hello, and welcome to Optimal Anesthesia. Today, we're diving into an exciting and practical topic, pulse wave velocity, or PWV. What is it? Why does it matter in anesthesia? And how can it guide us to deliver better care for our patients? Stay tuned. Let's start with the basics. Think of a pressure wave traveling through your arteries every time your heart beats. That's pulse wave velocity. It's a measure of how fast this wave travels, and it tells us how stiff the arteries are. In healthy, elastic arteries, the wave travels slower because the arteries absorb some of the pressure. But in stiff arteries, the wave moves much faster. And this matters because arterial stiffness is linked to higher risks of heart problems and stroke. How do we calculate PWV? The formula is simple. PWV equals distance divided by time. We measure the distance between two arterial points and divide it by how long the pressure wave takes to travel between them. The result? A number that reflects arterial stiffness. What are normal PWV values? PWV is age-dependent. For young, healthy adults, it's usually between 6 to 10 meters per second, m/s. As we age, our arteries naturally stiffen and PWV increases. By the time you're 70 or older, it could exceed 10 meters per second. But here's the catch: values above 10 meters per second can indicate something more serious, like hypertension or vascular disease. Take a look at this chart. It shows how PWV changes with age. Notice the steady increase? That's why PWV is often referred to as a marker of vascular aging. Let's rewind to 1808. Picture a world where Thomas Young, a polymath of his time, begins unraveling the mysteries of arterial behavior using principles of fluid mechanics. His work laid the groundwork for what we now know as pulse wave velocity. But how does this relate to modern medicine? Fast forward to today, and PWV is a cornerstone in assessing cardiovascular health. It measures how quickly a blood pressure pulse travels through arteries. The faster it moves, the stiffer the arteries, a key marker for conditions like hypertension and atherosclerosis. But how do we measure it? That's where science meets ingenuity. The gold standard is the carotid femoral pulse wave velocity, or CFPWV. Here, we time the pulse as it travels between the carotid and femoral arteries. It's precise, reproducible, and gives a clear picture of central arterial stiffness. For more accessible approaches, we have tonometry using sensors to detect wave arrival, or oscillometric cuffs, which work similarly to a blood pressure monitor. Doppler ultrasound and even MRI take it up a notch, offering real-time or detailed imaging of the pulse in action. And for the tech-savvy, wearable devices using surrogate parameters like pulse transit time are making waves in research and wellness tracking. Why does PWV matter in anesthesia? Now, let's connect the dots to anesthesia. PWV isn't just about numbers, it's about tailoring care to each patient. Let me explain how. 1. Preoperative risk assessment. PWV helps us identify high-risk patients before surgery. If a patient has elevated PWV, they're more likely to experience complications like heart attacks or unstable blood pressure during surgery. Knowing this upfront means we can optimize their health, adjust medications, and plan for closer monitoring. 2. Intraoperative management. Here's where it gets really interesting. In patients with stiff arteries, even small changes in blood pressure can cause big problems. Elevated PWV means we have to carefully titrate anesthetic drugs to avoid sudden drops in blood pressure. Be precise with fluids. Too much can overload the heart, and too little can cause low perfusion. Use vasopressors cautiously, as these patients already have increased afterload. 3. Postoperative care after surgery. Patients with high PWV are at greater risk for complications like heart attacks. Monitoring these patients closely and guiding their recovery with lifestyle changes or medication adjustments can make a big difference. Want to learn more? Dive deeper into the science behind PWV on our website, optimalanesthesia.com, where the latest evidence meets practical insights. Until next time, stay curious, stay informed.